getting a lot of stuff in the chat?
I haven't gotten
Nothing in chat, but there were. Here we go, we're going to be live in a second here.
You got 27 good minutes.
Is it going to be like the same link and everything?
Say what?
Is it going to be like the same link and everything?
Yep. Okay, you should be live again.
We're good? So just so everybody knows, we had to socially distance there for a while on YouTube, but we're back. What I was saying earlier is that the state of North Dakota and Custer District Health do a great job with trying to contact trace. They're working really hard at doing this. However, they're getting overwhelmed. They're getting overwhelmed by the volume of people that are testing positive for coronavirus. Right now, per capita, North Dakota is the #1 state per capita for coronavirus cases in the nation. We are New York, we are Florida, we are Arizona, all those places that were the hot spots. It is now North Dakota, all right? So really, when they're trying to look at this, they're trying to tease out which kid needs to go home and which kid doesn't, and it becomes somewhat of a judgment call, but they follow their guidelines as best they can. So just bear with them on that, okay? The whole point of quarantining, again, isn't to punish anybody. It's to limit the spread of disease. And if we can do that, then we can hopefully get kids in school and keep them in school, which is where they belong. Right? So the biggest problem that I see with the coronavirus pandemic in our area right now is that this is a community problem. You alluded to this earlier. This isn't a school problem. This is a community problem. Every community member needs to be washing their hands, socially distancing, wearing a mask, okay? We need to do this. Otherwise, we're going to continue to see cases. We're going to continue to see cases rise, and we're going to continue to have problems in the schools, and they're going to end up shutting down, and we're going to have distance learning. I see no other path forward than that unless every person in the community takes ownership of this and says, I want to do my part. I want to have a positive impact on this by washing their hands, socially distancing, and wearing a mask, okay? So one quick thing that I do need to address, it was a question that was raised earlier. This does not have to do with schools. It was a rumor that was going around regarding a bonus payment that doctors are paid if someone has a COVID diagnosis. And I can absolutely say without a doubt that this is false, okay? I get paid a salary. My salary hasn't changed in several years. My paycheck's been exactly the same. Our clinic is a federally qualified health center. Medicare and Medicaid pay us a flat rate no matter what diagnosis you have. And for private insurance, we base that on codes, which are based on what we do and not what you have as far as a diagnosis. So please just stop with the rumors, okay? Rumors like this erode morale.